Welcome to week 6 of DEN 200. So this week we're going to continue talking about amalgams, kind of going over class 2 amalgams specifically. So first, matrices when it comes to amalgams. So we talked about this a lot in, I believe, week 3. We're just going to cover a little bit more here. So a contoured and wedged matrix band is essential to prevent flat proximal contours, improper contacts, and overhang with our amalgam restorations. The most common material used today for an amalgam matrix is a thin stainless steel band on a Toffelmeyer retainer. And then you can review week 3's material regarding matrices, just to refresh yourself on the kind of the setup and what all the parts of a Toffelmeyer retainer do. This will be very important for your EFDA exam. When I took my EFDA exam, there was a big picture of a Toffelmeyer, and we kind of had to name all the parts of it. So you'll probably see this on your licensing exam. So it's always good to refresh that information. So next, let's talk about class 2 amalgam placements. Armamentarium needed is pretty much the same that we talked about last week for class 1 or class 5 amalgams. You're going to want your basic setup of your mirror, explorer, and cotton pliers. You're going to want some methods of isolation, so either rubber dam or cotton rolls, dry angles, something to keep the area isolated. You'll want an amalgam well, an amalgam carrier, various sizes of amalgam condensers, some burnishers, where your options would be football, beaver tail, ball, or egg-shaped. Various carvers such as the Hollenbeck or clearoid discoid. Articulating paper. Plus, you will also need for a class 2 your matrix retainer and your matrix bands. You typically want a universal band for shallow preparations and extended bands for preparations that extend more gingivally. Then you'll also want crown and bridge scissors, wedges, any additional instruments you may want for condensing and carving the interproximal areas, and some floss so that when the filling's done, you can confirm that there is contact between the teeth. So for class 2 placement, it's pretty much the same as class 1 placement, except you need to concentrate a little bit more and ensure that the amalgam is inserted accurately and you're condensing enough so that way there's no voids, especially in that interproximal area. Carving is also more challenging with the addition of the marginal ridges and the proximal surfaces that they need to be shaped to achieve the proper proximal and occlusal relationship. So that's just a little extra step compared to doing just a class 1 restoration. So next we're going to discuss the steps of placing a class 2 amalgam. First, we want to examine the prep and remember the size, shape, and depth of the prep. This will help us to determine if our final restoration is similar in looks, in appearance, in function as the original tooth was. Next, we're going to clean the cavity prep with water and dry it with air. If indicated, we're also going to place a varnish, liner, or base layer at this time as well. Next, we're going to apply the matrix band and wedge, and then we will mix the amalgam according to manufacturer's directions and deposit that amalgam into an amalgam well. We will then use the amalgam carrier to scoop up the amalgam out of the amalgam well, and then dispense half of the load of the amalgam carrier along the gingival wall of the preparation. Next, we'll condense forcefully and use overlapping strokes with a diamond end condenser perpendicular to the gingival wall. We're going to use vertical and lateral pressure and condense against the matrix band to ensure that the interproximal area is going to have a good contact. Next, we're going to continue to fill the proximal box by pressing the carrier against each increment to make sure it adheres to the previously condensed amalgam increments. Once the amalgam has reached the pulpal axial line angle, we're going to place the amalgam onto the pulpal portion of the restoration. We're going to use a large nib round condenser on the final increment to condense it at a right angle to the cuspal inclines. We're then going to burnish the surface in the same manner as we did with the class 1 restoration. We're going to begin forming occlusal grooves and fossae to give it some anatomy. Then we're going to use an explorer to carve the occlusal embrasure of the marginal ridge area before removing the matrix band. The area should appear rounded. And then next we're going to remove the band and the wedge. We'll then check for overhangs. We can use a Hollenbach to perfect the embrasure contours and cavo surfaces. We can also use a discoid cleoid carver to adjust the marginal ridge to the same height as its adjacent tooth. We don't want it to be higher, but we also don't want it to be a lot lower than the tooth beside it. We can then perfect the major grooves and pits and recreate the triangular grooves in the marginal facet. We then want to check occlusion, make sure that's accurate, and then we can burnish the surface as well to give it that smooth, polished appearance. And then last, we want to check the contact with floss, make sure that we have a good contact there that kind of has some resistance when we pull down on the floss. So these videos are going to be available to watch in the materials and resources folder. You can look at the Class 2 amalgam YouTube videos for the following few videos. Next, we're going to discuss finishing and polishing amalgams. Alright, so a properly contoured and polished surface on a restoration is going to not only benefit amalgams, but also composite restorations. One, it's going to contribute to the longevity of the restoration, how long it's going to last in the patient's mouth, but it's also going to contribute to the health of the surrounding gum tissues and periodontium. So, important to note, finishing and polishing should not be done on an amalgam restoration until it's reached its final set time, which is usually 24 to 48 hours after it's been placed. So this is not something that we can do on the initial day of the appointment when we're placing the amalgam. It's something that the patient is either going to have to come back for just to finish and polish the filling, or else it can be done at a future already scheduled appointment like a hygiene recare appointment. This is due to the fact that polishing and finishing prematurely can actually weaken the restoration. So we want to avoid doing that. We want to let it set in its natural state without disrupting it at all. That way it's not going to cause the filling to fail down the road. And there are some slight differences between finishing and polishing. So finishing involves removing marginal irregularities, defining anatomical contours, and smoothing the surface roughness. It's more so defining the anatomy, whereas polishing is going to obtain a really smooth and shiny surface on the amalgam, so that way plaque isn't attracted to it and you can keep it clean a little bit easier. So what are some advantages of finishing and polishing? One, it can help reduce plaque accumulation, which also reduces the probability of recurrent decay, and it also assists in the maintenance of periodontal health. Two, it can prevent the amalgam from deteriorating prematurely, so it can help prevent corrosion and tarnish of the amalgam filling. Three, it gives the opportunity to correct discrepancies in the anatomical contours of the restoration. So if you don't like the way the filling looked after you initially placed it, you can always go back in and adjust the anatomy a little bit more with the handpiece. And then finally, you can also prevent potential occlusal complications down the road by adjusting the bite. Some special considerations to keep in mind: creating too much heat while polishing is potentially detrimental to both the amalgam and the pulpal tissues within the tooth. Heat brings mercury to the surface, which leaves a dull surface. It is important to use abrasive agents in the order of decreasing coarseness, finishing with the least abrasive material. It's kind of like sandpaper, so if you start with a really large grit sandpaper and then end with a finer grit, you're going to get a smoother polish. On the other hand, if you start with the finer grit and then keep going up in grit size, it's going to just look like a scratch surface, and that's going to attract a lot of plaque and bacteria. That is not what we want. So what is the proper sequence for finishing and polishing? First, we want to adjust the occlusion before doing any finishing and polishing. We have to have the occlusion right before we can start making things look pretty. Next, we want to use rotary instruments. So we can use stones for bulk reduction. We can use amalgam finishing burrs, which leave the surface finer and smoother. We can also use finishing discs, which will help recontour and finish the amalgam filling. Next, we can use some hand instruments like a knife or file to remove excess amalgam. This is especially helpful interproximally. We can also use pumice or tin oxide, which are polishing agents that are used with rubber cups, similar to a prophy, it almost is abrasive to the surface and polishes it that way. We can also use sandpaper strips, which helps smooth the interproximal areas. You can watch this video along with any other videos from this week in the Materials and Resources section of your Blackboard folder. So next we're going to discuss evaluation criteria and factors that cause failure or success in amalgam restorations. Number 1, the amalgam should be smooth with no detectable pits or voids. The triangular ridges of each cusp should extend into the central groove. Fossa should be the correct size and depth in the correct location. Major grooves should be distinct and in the correct location as well. Supplemental grooves that are in adjacent enamel should extend into the restoration. No open margins or submarginal areas that cannot be smoothed during finishing and polishing. The amalgam should not extend beyond the cable surface margin of the restoration. In other words, no flash is present. And the restoration should occlude with the opposing teeth simultaneously with the uninvolved teeth. So we want to make sure that the restoration isn't hitting the opposing tooth too soon. This could cause a lot of issues in the future down the road, especially TMJ issues if the occlusion is not correct. The restoration should not be out of occlusion though. If it's out of occlusion, that can cause issues as well. The tooth can start to drift to try to find occlusion with another tooth. The marks from the articulating paper should be of equal density on both the restoration and surrounding tooth structure. So we don't want any marks to be darker on the filling, but we also don't want them to be a lot lighter on the filling either. We want them to be pretty similar in density as the filling tooth and any adjacent teeth. The patient should also state that the occlusion feels fine. This is sometimes difficult if the patient is numb, but a lot of the times they should have a good feel even on the other side of their mouth where it's not numb if the filling is too high and it's affecting their bite overall. The marginal ridge should be rounded to form an occlusal embrasure, and the proximal contour should be convex facial-lingually. Occlusal gingivally, the contact area should be convex from the marginal ridge throughout the contact area. The lingual embrasure is slightly larger than the facial embrasure, and the contact catches or offers resistance when flossed. You don't want to just drop the floss down and there's no resistance at all. We want some resistance so food's not getting trapped in there. And then lastly, we'll talk about some causes of amalgam failures. So amalgams can fail due to wear that affects marginal integrity from leakage. So if the person is grinding and clenching a lot and it's causing wear around the edges of the amalgam, it can allow leakage to get into it and then cause recurrent decay. There can also be inadequate condensing, leading to corrosion, decreased strength, and even fractures. We want to make sure when we're placing amalgam, we are really condensing them hard into that preparation. That way we don't have any of these issues. Creep can also cause amalgam failures. This is the prolonged exposure to stress. And a faulty cavity prep design can also lead to fractures. Just the way that the dentist designed the prep, if there's an undercut somewhere or something along those lines, the tooth is more susceptible to fracture in those areas. Thanks, guys.